Hi, everybody. My name is Chris Lewis, and I'm the Executive Director of the Great American Songbook Foundation, and welcome to the Songbook Academy. This is a week-long performance intensive for young high school singers. We are just beginning a week of master classes and workshops with an incredible panel of mentors, coaches, and guest artists from the worlds of Broadway and the music industry. We are excited that our new virtual program this year allows us the opportunity to share some of these workshops with you. We always start the week off with an emphasis on vocal health and vocal technique. And leading the session today is Catherine Walker. She's an educator from the University of Michigan's world-renowned musical theater department. She's also an accomplished music director and voice teacher, and she's been with the Songbook Academy for many years, and we always love her workshops. I've been a singer all my life, and I learn something new in every workshop, every time I sit in with Catherine. We hope you enjoy today's workshop, and be sure to visit thesongbook.org to look for other opportunities throughout the week. I want to give a special thank you to our Ella Fitzgerald Charitable Foundation Mentor Champions for making programs and workshops like this possible. Catherine is the Brian and Kelly Smith Mentor, and we want to thank them for making her participation possible. And now I turn it over to Catherine Walker.
Hello, everyone. I'm so happy to have you here. What I'd like to talk about in the next hour is a very quick run through of body anatomy, a body map, a great warm up and cool down routine for you, as well as some information about breath and support. So that's all what we're going to try to accomplish here. So without further ado, I'm going to share my screen with you. And here we go. Okay, so we're going to start out today talking about body mapping and warming up. So, and give me a thumbs up if that's what you see on your screen. Awesome, great. So the question most people ask is, what is a body map and why should I care? So the body map is for you to really know where all your body parts and everything that makes up our vocal mechanism is located. Well, why is that? Why is it important to know and have an accurate body map? Well, the fact is, studies have shown that we actually move in our bodies according to the way we think we are put together rather than how we are actually put together. So for example, if I didn't know I had this joint and I were moving my arm, I would think these were my only options. But then all of a sudden somebody says, but you have this option, and now I can move my arm all the way up. And it sounds silly, but we really are limited by what we know about how we can move or what our predestined ideas are. So what we're trying to do is really update that awareness. So we're going to check your body map, and I'm going to ask that you all do this with your eyes closed. And the reason is I want you to, by closing your eyes, step up your proprioception, meaning step up your ability to feel things. That's the first thing. And then also I'd like to know what you really think rather than have you take visual input from others. So the first thing is, if you were to put your hand behind your head, you can feel your hand. You know exactly where it is. You know what it looks like. Why? Because you have spent a good portion of your life dealing with your hands. You see them, you use them every day. We're very closely connected. However, if I said, I need you to feel your heart, you might have a little bit more trouble because it's inside and we don't have a real clear picture of that. So what we're going to do is see where these body parts are inside, because they will impact your singing. If I tell you to point to a specific part, be specific with your fingers. So if I said, point to your nose, you would literally put your finger on your nose and hold it there. If you are being asked to point to a part and you have no idea, just leave your hands in your lap, because that's a perfect opportunity for me to be able to see how I can help you find that part. All right, so eyes closed. Let's see how we do. Okay. Where is your larynx? Touch your larynx and be very specific. If you could use one finger, it would be lovely. Where are your vocal folds? Where are your lungs? So if you can kind of give a region, top and bottom, that would be lovely. And if you need to adjust where you're standing or sitting so that I can see you in your camera, that would be great. Great, nice adjustments, everybody. Interesting. Where is your diaphragm? Where are your ribs, top and bottom? Where is the root of your tongue? Where is it attached? Remember to keep those eyes closed. Beautiful. Where is the top of your neck? Interesting. And lastly, where are your abdominal muscles? And again, you may have to stand or move so that I can see that in the camera. Great. Okay, so relax, eyes open. Let's take a look. So once again, I'm going to do a new share here. And we're going to take a look at some body parts. So if all is well, you see now some anatomical parts. Now these are the handouts that you received, but we're going to go through it together. So first of all, the first question I asked you is, where is your larynx? So I'm going to go down here, and you see this sort of clarinet shaped organ right here. That's your larynx. It looks like, I say clarinet mouthpiece, really. That's what it looks like. It's shaped. And your vocal folds are this tiny thing right here. And then I want to point out, I didn't ask you where this was in the body map, but I want to point out while we're here that this is what we call the trachea. And if you take your finger and run it down here, you're going to feel those, what we call cartilaginous rings. And they're there for a purpose. They have a reason to be there. And that reason is that they keep the pipe open. Because if it collapsed every time you had to take a breath, that would be very labor intensive for as many times a day as we breathe. It would be very, very difficult. So those rings keep that open for the air to pass through. Now back here, this little area, believe it or not, is your esophagus. That's where the food and drink go. So they are separate tubes, but you'll notice that is flat. And that remains flat until you eat or drink something. And the way that the body knows which is this little guy right here. Looks like a potato chip. That's called the epiglottis. This will close down over the trachea and allow food and drink to go over the back and down into the esophagus. And that's why when you laugh, if you're laughing or speaking and you're drinking or eating at the same time, you may choke. And it's because there's a little bit of a mix up with the epiglottis doesn't know which tube to send it through because you've sent quick messages and it can't process them. Okay, so we'll kind of empty this out here. All right, let me delete these. And delete that. Okay, all right, so now let's go back up in here. So we now know where the larynx is, the top of the neck. Now I'm gonna look at that while we are in this position. Some people think of the top of the neck being right here. But really it's up here between the ears, kind of directly behind the nose. And why is that important? Because if you are compressed down and you're moving in a very compressed state here, you're taking this whole pharyngeal, this is the pharynx, you're taking this whole space and you're compressing it. That is going to put pressure on your larynx, and it's going to make it more difficult for you to sing. So let me get rid of some of this crazy highlighting. But while we're here, I want to talk about a couple other parts before we get into lungs, diaphragm, etc. Let's talk about root of the tongue. Now, the tongue is very impactful to singers, and when you see size, you will understand why. This whole pink, almost looks like a cauliflower here, that entire thing is tongue. It attaches behind the chin. So if you take your thumb and put it right up behind that bone right here, you may find, if you press very firmly, you may find a little bit of tension. If you hold it there, your tongue may actually start to almost jump a little bit, and you are really getting at some tension there. The other place it connects is way down here. So if you draw your finger here, this is all tongue. Come down, come down, come down. Find your Adam's apple, otherwise known as your larynx. So now we know where our larynx is. Your tongue attaches just above that. So the tongue and the larynx are linked very, very closely, and they can impact each other. So it's important to know that. So now find your Adam's apple, which is the largest bump in your throat. If you feel a little gaggy or queasy when you do this, just inhale through your nose and let your body know you're not choking, and you can kind of calm that down. When you are here, if everyone can hum, you'll feel buzzing here. And that is where your vocal folds are located. They're inside of the larynx right here, number 11, right there. And they look like this. I'm now over on the right side of the page there. So when they're closed, they're here, right? And notice how they're white. That's how they really look in life. But when they open like this. So they don't open like a stage curtain. They open so, right? And that's, again, important in the whole mapping of things. Let me get rid of this highlighting. So remember the tongue, it is important. And by the way, a low tongue, if I squish my tongue down, if I take this and I press it down, so I'm going to push it out into this space, and that space is part of our resonating space as a singer. So this chamber right here has 3 parts, right? It's a pharynx, which is a chamber. And we have a pharynx that's behind the nose, so we call it the nasopharynx. It's related to the nose. We have this one right here, which is right behind the mouth, so we call that the oropharynx. And then this one just above the larynx is the laryngopharynx. And those 3 chambers dramatically impact your singing and are areas that your voice teachers are playing with all the time. By the way, while we're here and talking about this region, this little guy right here is your soft palate. So when people are saying, lift your soft palate, they're saying to take this, create a seal so that now all of the air is going to come out my mouth and not through my nose. If it's all the way down, all of the air comes out my nose and not out my mouth, which we'll talk a little bit more about that. Then there's the magic mid soft palate, or mid velum is what we call it, which is really common in pop music and musical theater. A lot of contemporary styles use a fair amount of nasality, where we have some air coming through both the nose and the mouth. Okay, so any questions while we're on this anatomy piece right now? If we can, let me see. I think I'll stop sharing so I can look in the chat window before I go any. When does the larynx move up and down? And do the yes. Okay. So the question, Hannah Bank, excellent question. When the larynx moves up and down, do the vocal folds follow with it? Yes. And isn't that fascinating? So if you think, everybody do silently, well, you're on mute, so you can do it out loud. You're going to go, wee, and you feel the larynx go up. amazing. We do this all the time in life, right? So the larynx kind of just knows what to do. Is it healthy for the larynx to move up and down while singing? Yes. And in fact, it's an important thing to adjust, because by moving the larynx to a different position, which sometimes is lower and sometimes is higher, we are changing something called the resonant frequency, meaning the way the frequency is bouncing around in the pharynx. And by moving that larynx tiny incremental bits, we are changing the shape of that and therefore impacting your singing. So it's not always that we want it high, and it's not always that we want it low. So that's an excellent question. Does being tongue-tied have an effect on singing? Yep, it does. If people aren't aware about what Leah is referring to here, underneath your tongue, you have a piece of tissue, like almost like a little string attaching, and you can see it if you look in a mirror very easily. It's called the frenulum. And if that is a bit on the short or tight side, and you can't stick your tongue very far out of your mouth, it can impact you. So that is something you would want to, if it's very severe, you might want to consult someone about that. There are people that make adjustments to that. So that is beyond my purview, but do know that it can impact you. You can work around it pretty well, but if it's really short, you may want to consult a physician. Does your vibrato come from the jaw, tongue, or vocal cords? All right, so that's a really good question. The question is, where does vibrato come from? And you know what, honestly, the jury's out. I say they're still studying it. What they have found is jaw vibrato is manufactured. So if I go, an exaggeration, but something we would want to avoid doing. Also the tongue, kind of don't want to do that. Some people also can do it with the breath, so it sounds almost like a machine gun. So they go, ha, ha. It's almost like Elmer Fudd, silly wabbit, silly wabbit. And that's a very rapid fire breath vibrato, and some people use that. If all is going well and the voice is functioning optimally, there is a little shaking in the vibrato or in the larynx, which they feel produces vibrato. So that's probably a very complicated one that I won't take too deep a dive with at this point, but know that it is natural. If you are singing regularly and don't have vibrato, it's probably because you're in a holding pattern that is stopping it from happening. So learning to release more would be really helpful. Could you please explain what is happening when it feels like food went down the wrong tube? Oh yeah, that makes perfect sense. So if you remember in our picture, in fact, let me go back to the picture. Okay, so if this epiglottis here, right there, come on, there we go. If that does not sufficiently close the trachea, then the food will sneak into the wrong tube and you will choke. And that's just a very common thing that happens. If you're laughing, older people have trouble with insufficient swallowing as well. So that's what happens. It's not, most people can just cough it away and then you're fine. So here's what I'm going to do. I'm going to answer questions for about 3 more minutes, and then I'm going to keep going so we can get to the vocal rebalancing. But you have such awesome questions. I want to try to get to as many as I can. And then if I don't get to it, I promise I will later in the week. If the tongue isn't stretchy, is there a way to stretch it without surgery, or is that a surgical fix thing? Ava, could you unmute and tell me what you mean by stretchy?
Hi, it's me, Ava. When you were saying for the question, 2 questions above, does being tongue-tied have an effect on singing? You were talking about the thing in between your tongue when you lift it up.
Yeah.
Yeah, if that you were saying how like it can affect you if it's like not like able to
Really tight.
or whatever. Yeah, like real if it's like really tight. I don't know if this just like came into my head or whatever, but is that like something that you can fix like with just almost like physical therapy type stuff, or is that like a surgical thing?
Depends, probably depends on the situation. And again, that would be beyond my purview. And something I would say, if you feel like you're tongue tied and it's getting in the way, you can go to a voice clinic and have that evaluated, or see a speech therapist and they can check. Because you're right, a lot of times it can we do it with physical therapy and just kind of increase that stretch and make that feel a little bit more relaxed. And then if something more is needed, they would talk to you about that.
Thank
If you
you.
are singing you're welcome. If you are singing in a mixed voice, how is your vocal tract different from when you're singing in a more pure chest or head voice? That is a very, very complex question, and an excellent one from Ava. So I think I'm going to hold off on answering that for a little bit, because I think that may send us down a path that could last until next week. But I think I'll address it very slightly in the way that I'm working with people. So keep your ears open, Ava, and I think you'll hear that more in the coachings. How do vocal nodules form? What unhealthy singing habit lead to the forming? And you hope the vocal holds. Okay, so if Michael's question has to do with vocal nodes, prenodular conditions and all the way to hard nodes can come from vocal use and abuse, mostly the abuse part, obviously. If you start feeling cough, tickle, scratch, or a lot of fatigue or holes in your voice, then I would say you should consult a voice clinic and have it evaluated. They will do a laryngoscopy. In fact, I can show you. Hang on one sec. Let me share the screen one more time. Hang on one sec here. New share. Okay, so that's the old scope right there, the rigid one. Today they go, can you see that, right? Yes? They go through your nose, they anesthetize it, you don't even feel it. They go down over the top and take a really great picture of what's going on inside. Is there treatment? Yep. A lot of times if you catch it early enough, if you have some vocal issues, they can actually do it with voice therapy and retraining you. Mostly it comes from constricting, overworking. Yeah, constricting and overworking. So that will sort of abuse the voice. You have to remember the vocal folds are basically the size of your pinky fingernail in length. And if you could try to fathom that those little tiny membranes of skin are creating your sound, those little folds, they're tiny and they're very delicate, and we ask them to do a lot. So I think that people sometimes, they think it's cool to go to a game and lose their voice for a couple of days. I wouldn't advise it if you're a singer. So just be aware. I think you're all extremely smart and aware and care a lot about your voice. I've heard that clearing the throat before singing is harmful. It's wise to not do it, because again, if everybody were to do that, you feel that they're coming together like cymbal crashes, right? And again, if you did that over time, if you had been ill, this may have happened to you where you cough a lot, and then all of a sudden days later you've lost your voice, and it's because you have continually done this. So take a cough suppressant to try to avoid that, or if you can cough or clear without bringing the folds together, and I'm sure Kathleen will talk a lot about this. She's brilliant when it comes to vocal health. So some of these will tongue tension, Sean, we're going to get to that. Awesome. Acid reflux. Okay, that again, consult your physician if you have acid reflux, but a lot of it has to do with when you eat. The later you eat, the more trouble you're going to have. That's just the way it is. So I'm going to get back to unpacking my anatomy. Keep those questions coming, but if I don't move on, we will run out of time. So let me get back to this. Okay, we should be back to the anatomy. So this is an important picture I want you to see. The ribs extend all the way from way down here at the bottom, all the way up to the top rib is under the collarbone, as you can see right here. So they're way up here. Your rib cage is quite large, but you will notice that the lungs live quite a ways up inside the ribs. And the diaphragm is this sort of burgundy color. Let me color that in a little bit right there. There's your diaphragm right there, which means it's rather high. It's way up here. So when people say breathe from the diaphragm, what they're really wanting you to do is to release these abdominal muscles, which happen, they're all the way around you, by the way. They form a circle around your whole body. And when they expand, if you feel your front and back expand, or your waistband gets wider, you will feel that the diaphragm then is able to drop and the lungs are filling. So when people say take a low breath, which a lot of people will say, what they're really saying to you is relax those abdominal muscles and the pelvic floor so that this can fully descend. But be aware that it's very high up in the front, and in the back, it attaches way down here in the back, at the bottom, just at the lumbar spine, which is kind of fascinating, really. It's quite large. In fact, I'm going to do one more new share with you so you can kind of get a better picture of this. Okay. Okay, so you can all see this, right? The diaphragm? Yep. So it's like an upside down dome. And you can see that the ribs are here on the side. Yeah. And then the lungs are above. So it rides much higher than people realize. And it's this dome that kind of attaches in the front here, way up by the sternum. If you've done CPR, you'll see there's your xiphoid process right there. That's where the diaphragm attaches, right behind that, which is kind of incredible. So it shows it here, and then it kind of the attachments go up behind there. And then when the diaphragm descends, it doesn't go down like this. It doesn't go up and down. It does this. So it actually moves all the organs out, which is why you feel like you get broader in the front and your waistband expands. So it's, again, mapping where the air is, where the diaphragm is, where the abdominal muscles are, and don't forget about the abdominal muscles in the back. Get rid of that. Okay, so let's see, stop share. All right, here we go. Top of the neck, we talked about abdominal muscles, root of the tongue. Good. All right. So are there any questions? Tongue touching, yes. Reflux, yes. Okay. So next we're going to get to our rebalancing exercises. You all have a sheet that looks like this. I'm going to get to as many of these as I can. And then I want to take a few minutes at the end to talk about breath, because I think it's really, really important. So some of these I'm going to speed through because I think you can figure them out on your own. And others I'll spend a little bit more time on and have a few people try them because I think they're very, very helpful. Massaging the face and the lips. This would be something I would regularly do if I were going to sing. Just take all of these muscles, just as you would if you were a runner. If you were a runner, you would go out and do a number of stretches. You might even do a yoga class. Dancers will do a yoga class or a stretch routine before they even begin to dance. Same thing as a singer. Get your body ready. Lip trills. Everybody, I think, is fairly familiar with lip trills, right? But you can also block off one side and do the cheek and this side, and then the other side, and then the center. about the cheeks. So Emily, would you just give that an unmute there and say hello? And would you try one of those side lip trills, if you will, block off half your mouth and give that a whirl. Now do the other side. Great. Now, do they feel exactly the same to you?
This one's a little bit easier to do.
Thank you for saying that. So everybody, word to the wise, we live in our bodies asymmetrically. In other words, that's why when we take a picture of somebody and you cut it in half and duplicate it, you don't look like yourself anymore, because this half of your face, even though it looks like it's identical, is not. Does that make sense to everyone? So same thing in our bodies. We're bilateral, but we don't move symmetrically. So therefore, we might find, oh, I sleep on this side, so it's tighter. Or I always chew on my right side. Things like that. So we are habituating these patterns in our bodies, which are going to impact our singing. Okay, awesome. Great. Let's look at some tongue things. So this is Sean's question about tongue tension. So I'm a huge believer that the tongue makes a big difference. And if you remember from our anatomy picture, the tongue was really big with these little tiny vocal folds underneath. So I think of the tongue as the Atlantic Ocean and the vocal folds as the Virgin Islands. So when a hurricane comes, it's a big deal. So we want that tongue to be as pliable as possible. So one way at it is to kind of put your fingers in here, explore a little. Another would be tongue trills. Now, some people have trouble doing tongue trills, and I want to encourage you to invest some time in learning. And one of the ways you can do that is to do a raspberry first, and then and just flip it up with the same relaxed feeling until you can find that actual tongue trill inside the mouth. It is teachable, it is learnable. So I had trouble learning it myself, so just encouraging you to do that. Now that's going to release the end of your tongue, but the tongue, as we saw, is quite large. So how do we work on the back? Well, we want to do in the very back where the soft palate, let me see, so orient, here's my hard palate, there's my soft palate hanging down, here's the back of my throat. I'm going to bring these together and I'm going to bring the tongue up, and I'm going to make a connection right there, and it sound a little bit like Chewbacca. And you can actually sing. So is anyone able to do Chewbacca? And if so, just unmute and say hello. I just would like to hear somebody try it. It's a tough one for people, so that's why I'm wondering. Anybody? Any brave souls?
Can you explain how to do it again? I want to try, but I'm afraid of failure.
Oh no! Who's talking? Who's?
No, it's me. Yeah. Oh gosh. Now I'm
Okay.
No, I don't even think I can do it. I need like an explanation again. Maybe I'll.
Okay. So if you were to say the letter K, K.
K.
All right. Now stop before you release. Prepare a K. Just prepare it. Now you're going to exhale through that. And that's the back of your tongue, not the front, right? I feel like you're doing the front.
Oh yeah, I am doing. Wait, hold on.
There you go. There you go. So it's basically setting up for a K. Does that make sense, Grant?
Yeah, that's new to me. I like that though.
Yeah. Yes, because what it's going to do is it shakes loose some of these patterns that you might be holding in your tongue. All right?
Yeah.
And another one is it's straight back, like in the mouth. If we want to get to the oropharynx, which is right in this area, again, we're going to close off like I'm going to go, like I'm almost going to cough. But this time I'm going to exhale, and it's not pitched. So it's not one that you can sing with, and you'll sound a little bit like Daffy Duck. And it sounds a little bit like someone might think, "Ooh, is she hurting herself?" No, because I'm not grabbing here. I'm doing it way up back there. So it's like the K, but it's more in my mouth area. Would anyone like to try that? Hannah Bank.
Okay.
Very good. So now can you say the words with the front and go,
Yeah. Wait, no, that's Chewbacca. Closer.
yeah. So relax the front of your tongue.
Okay.
So you want a little bit more drag in the back, less
Okay.
air escaping. Almost like if a cat had a hairball. Yeah. Okay, that's the right idea. So that's a good one. And then gargling. So that's lower. So we've kind of taken the three pharyngeal places. Remember, a pharynx is a chamber, and it is the money of your resonance. We also have mouth resonance, which is important, but boy, that throat is really, really, really impactful. And we have three chambers to think about. So if I'm gargling, I'm then taking those tissues and moving them around a little bit. And again, you can sing. So you go, right? So you can kind of move things around there. Does anyone want to try the gargle? I love that you're all being so brave. This is awesome. Unmute and say hello if you're willing to try the gargle.
I'll try it, Lydia. Hi. All right.
Okay, so hang on, Lydia. So Lydia, what I want you to do is make the front be very specific. So happy birthday to you. You can still do that out here while gargling. So it's kind of learning, oh, I have a whole new coordination I can use.
Okay.
You make happy birthday to you. Yes. And that you can actually go from really not having any sound to getting something out. So if you've been sick or you're really tired and you're like, oh my gosh, I have to sing today, I'm really worried, these will be things to kind of loosen things up. But I want to be really clear, when you're gargling, you are not gargling your folds. Remember that the folds are now covered, right? Because you now know that that epiglottis closes over them to protect your lungs so you don't get fluid down there, right? So what you are doing is you're taking all the tissues above and you're just kind of shaking them loose. You're giving them a good vibration. Yes? Does that make sense? Everybody good? Thumbs up? We good? Okay, awesome.
Yeah.
All right, tongue twisting. Let's talk about this because I'm going to spend a little more time on the tongue. So if you're really coordinated with your tongue, you'll be able to do this. And if not, I want to give you a takeaway. So you want to take the tongue, draw it across your front teeth, and then flip it over so it looks like this. And then you keep it out of your mouth while you are talking. So it's happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. What you're going to find is certain vowel and consonant combinations may pull the tongue back in. You want to practice keeping it out. Then you want to practice going the other way. So you want to flip the tongue in both directions. And again, it's to work the middle and back of the tongue because we spend so much time thinking about the front of the tongue. The middle of the back of the tongue have tremendous impact to our resonance and our diction. So just be aware of that. Another one is to take the tongue, the tip, and glue it behind the front teeth. So where the hard palate and the front teeth, if these are my teeth, this is the hard palate, and there's like a connection right here, which we call the alveolar ridge. Okay? And you're gonna glue it there no matter what. And you're going to try to say happy birthday, happy birthday, happy birthday to you, happy birthday to you, happy birthday, happy birthday, happy birthday to you, without it letting go at all. And again, you will feel that the back of the tongue really working hard. Your tongue may be getting tired. Let me check in with some of these questions before they leap past me. You are amazing. Wow, special skills. Yes, let me go on. Emily, how did you get from you can gargle happy birthday.
Sorry, I was asking about emojis for a while.
Yes, I'm trying to get through the questions here. When you are gargling, does your soft palate drop? Yes, it's down. It's I would be, yes, it's closed. It's closing off. Yes, that is correct. For some reason, I can twist my tongue only one way. Yes. So, Eve, I want you to know that when I first learned to do this, I had to physically turn the tongue because my proprioception, my brain couldn't find the connection to go the other way for whatever reason. I have no idea why.
That really hurt.
Where are you, Eve? Let's get you up here.
I don't know. Oh,
There you are. Yeah. So let me see your tongue twist. Yeah. So okay, now try to go the other way. Yeah. Yeah. So what I want you to do later, just it would be really fun, and then check back in with me later in the week. Literally wash your hands first, take your tongue or a paper towel or something that you can grip your tongue and try to physically flip it so that the brain starts to understand what you want. The brain is very, very quick, but it might need help from you to identify where it needs to go. And somebody said that hurts my TMJ. Okay, so if you have a tight jaw, is that Emily that said that? Yeah, if you have a tight jaw, working with your tongue can help relieve your tight jaw. It's probably impacting why your jaw is tight because the tongue attaches here, it attaches up inside, right? Back here, it attaches here, and it attaches here. So it's a whole, I best refer to it as a complex. So that tongue can have a lot of implications on what's going on with your jaw. Not a surprise. I can't seem to twist it either way. Oliviana, keep working on it. You can do it. Flipping the tongue gets addicting once you learn how to do it. All right, I love it. You guys are so awesome. Okay, and now the last thing on the tongue is to stick your tongue all the way out and not let it come back in no matter what. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. So these are all things for you to practice. I would suggest that you practice them in a mirror because what you're going to find is that you will start to see if the tongue pulls back in, and then that would be something you would want to address. All right, so I'm going to keep moving because it's 1:52 and I have my eye on the clock. So Sirens. So on an NG, which is the low soft palate, sirening softly is a great way to warm up and eventually cool down. So let's talk about why you have some of these toys. So this, if you have water in the cup, what this does is it creates a little bit of resistance, which we call SOVT or semi-occluded vocal tract. It focuses airstream and gives it a little resistance. But using the water in the cup, I should actually have a little bit more. So we'll just imagine that I have 2 inches in there. What you want to do is not let the bubbles jump out of the cup or change velocity like this. And then all of a sudden they go faster and louder. You want it to be the same, whether you're low or high. This was what Cynthia Erivo used every night in her dressing room to practice for her 11 o'clock number in color purple because she wanted to make sure she wasn't driving air in her belt. Okay, so that's a really, really great tool. Sometimes you can just take a straw. So this is a great little practice tool and a warm-up tool. So if you are somewhere where you need to be quiet, it's just a wonderful way to calm things down and slow the breath. I should say slow the velocity of the breath and the amount of breath you're using. So I highly recommend straws. They're very, very helpful. Blowfish. All right, so you may find yourself in a situation where you're waiting for an audition and you need to feel warmed up, but you have no place that you can actually do it. This happens a lot. So what you can do is take a cup with the one with the tiny hole, and you want to seal it so that you have the Dizzy Gillespie puffed out cheeks. And you can sing very loudly into a cup. And you want to keep those cheeks puffed the whole time. And that will cause what we call in voice science world reverse impedance, which basically means it creates a backflow, it backs the air up, and voice loves it. It responds extremely well. And that's why we use all these crazy SOVT exercises. So if you find yourself needing to warm up, use that cup. You can use one without a hole. Two, if you really want to just feel like you're using air to back into the pharynx and barely leaking any out, and then you have that cup. So those two are really helpful. You have like a little practice mute. So if your parents go to bed and you're like, oh man, I have to practice, just use a cup. No one will hear you. And you can actually get a lot done, and you can sing full out and not get tired. It's pretty amazing. You can do that also within your mouth. Let's say you don't have a cup. You think, oh, I forgot my cup, rats. Or I don't have a straw, right? So this time I can just puff the cheeks and make a blowfish. You can sing very loudly inside your mouth and not make any sound, right? So these are great ways to warm up before an audition. If you find yourself in a college audition setting and you think, oh my gosh, I can't warm up, I can't find a practice room, you can use the cup with a hole in it. You can use the blowfish. So I find that the cup works a little with a hole, works a little better for me. But then if I have one of these, then I can put water in it and use my straw. So that's why I have two cups. So in answer to that question. Okay, inhalation phonation. Now this is one that takes people by surprise, but again, it's a really great way to get the larynx to release and warm up. So if you think normally the air is coming out, so the folds are doing this, that's how they open and close. They sort of do this rolling action. Well, if I'm going the other way, all of a sudden I've mixed it up. I've confused it a little bit, and the brain really responds well to that. It will all of a sudden, you have its attention, right? And the way you're going to do that is by inhaling. So if you think, happy birthday to you. Happy birthday to you. I am inhaling. Now, I want to caution you to inhale very slowly and gently. If you start coughing, you're probably pulling the air in too quickly. And you also want to start on an exhalation. So you would blow out. Happy birthday to you. Happy birthday to you. Exhale. Happy birthday, etc. Would anyone like to try it? Anyone want to try inhalation? Eve, go for it.
Okay. Happy birthday to you.
Great, do it again.
Happy birthday to you. I'm like running out of air.
Yeah, you will have shorter phrases. Start with an exhalation. And the other thing is I want you to go, uh-oh, on the inhale. Just do an uh-oh, inhaling.
Uh-oh.
So make a glottal onset. Put your folds together and go, uh-oh.
Uh-oh.
Yeah, so rather than an H, you want to think, uh-oh, oh. Try it again.
Uh-oh.
Yes, and you hear how clear it is that way?
Yeah.
By the way, I'm laughing at someone saying my mom never wanted me to blow bubbles in a restaurant. And here all the time you were just doing some SOVT, Kara. There you go. All right, one more time. Oh. I want to go, happy birthday, you. Nice and clear like that.
Happy birthday to you.
Yes, and you will find that a few minutes of that can really warm up your voice in a really amazing way. So put that out there for you. Also, yodeling. Now, we often find that people are trying to get rid of a yodel, right? Meaning a break in the voice. If I go, ah, we often don't want that to happen when we don't want it to happen. But there are times that we actually do want it to happen, depending on the effect we're making. If it's popular music, gosh, they yodel all the time now, right? So if you are struggling with a register shift where you are breaking, you don't want to, yodeling is very, very helpful. So it's not this, oh, that's just changing pitches. It's literally flipping, oh, you can kind of hear the clunk, right? It's like a donkey, or Tarzan, oh, it's that kind of a yodel. So when you are struggling on a break point, yodel a little and then try it again. And you may find that you find your way through that passageway a little bit more elegantly. What's happening when we get to a break point is the brain is stuck in something that's sort of binary, meaning it's like, here's one thing, and now here's another. And it jumps up. And what we're trying to do is find out what that transition is. And by yodeling, we kind of shake it up a little and get some sort of an integrated sound. And that's how you will make your way through those. And then, of course, if you don't have a yodel, it's important to find that again if you're going to sing contemporary musical theater repertoire. Yes? Does anybody want to demonstrate a yodel? I'd be so fascinated. Who's my yodel? Somebody I haven't heard from yet.
Oh, my bad.
I will happily yodel.
Who's happily yodeling for me?
Lily. I'm Lily.
Lily, yodel
All
for
right.
me.
Yo, yo, yo.
Good, now go, yo.
Yo.
Do you hear how it wanted to turn into a sing?
Yeah.
And away from a yodel? Do it one more time. Yo.
Oh.
That's an awesome yodel. And then eventually you can go, oh. You can kind of yodel back and forth.
Yeah.
There's a great recording of a guy that he's an amazing yodeler. So I'll try to share that with y'all. Okay, so I'm running out of little time, so I'm going to leave the rest for you. I'm going to leave the rest for you to kind of take a look at, because I want to talk about one more thing before I run out of time, and that is the breath. Many people think of the breath and support being connected, but they aren't necessarily. So if I ask you to exhale and then put your hands together, so blow out, and then without inhaling, press and engage. You can feel all those muscles engage, right? And connect. So that is connecting without using the breath. Now I want you to take a big breath and do nothing with your body. That's a huge breath with no support. So they can be unpacked. And the reason for knowing that has to do with why you have a balloon. And I want to show you this very quickly. Everybody take your balloon and notice that if it's just sitting there by itself, the air inside the balloon and the air in the room are the same pressure. So there's no tension here. So if we think of this as our lungs, and this right here is our vocal folds, and I put a little bit of air in here, just a little bit, and I close this off, my vocal folds have to do a little bit of work to hold that air in there, right? So take a little tiny breath and close. Not too bad, but there's a little effort, right? So exhale. Now no effort. All right, now we're gonna put a little more air in here. Now I need more effort to hold the air in there. My fingers have to work a little bit harder. So I want you to take that same breath in your lungs and hold here. Now I have to work harder. Okay, let it out. Okay, now one more. Take a big breath and pay attention. You can take a big breath here. Take a big breath here and close and feel what's happening right here in terms of pressure. What do you feel? Anybody? Somebody that I haven't heard from, if you could chime in and say what you feel when you take a big breath here.
Hi, I'll talk. It's Samantha.
Samantha.
Yes. It feels a lot like there's a lot more pressure right here, kind of. It feels a lot more tight than normal.
Yes. So here's the moral to the story and why we're talking about this with regards to breath. When we sing, here's our little handy dandy larynx model. These, when we go higher, these stretch out and they get thinner. So they're not as strong, they're not as thick, they're not as tight, right? They're in mass. So when they get thinner, like a rubber band gets thinner when it stretches, if I am going to drive more pressure underneath, then these cords are going to have a harder time holding on. So when we are singing, we have to decide the amount of breath that we need to optimize the sound we are making, but too much air can be detrimental because it's causing pressure, which is going to make this constrict and get tight. Does that make sense, everybody? More air is probably not the answer. The answer is probably that you need to anchor more. So that is why you have this guy. So take your straps, your TheraBands, and I want you to just take a little breath and then stretch this. So exhale first, inhale, and then stretch. So now you have air, probably enough air for your phrase. You didn't need to get tight and you've activated your support system. Does that make sense to everybody? This is a huge piece to the puzzle because most people think I just need a bigger breath and they try to breathe before high notes and they invariably crack. So I wanted to make sure that we got to that. All right.
Miss Walker?
Yes, we are running out of time, but yes, who's talking?
Alex.
Alex. Great. What is your question?
I was going to ask, so when you're talking about like the breath and support, is this what you kind of mentioned when we're keeping the same level of energy when we're like blowing through our straws and stuff like that?
Yes, because what we want to do is engage and have support without constricting and driving air. Most people think high belting requires more air when in fact it's very efficient and we don't need a lot of air. Belting is a very efficient vocal recipe that actually uses less air than saying, "Whoo," that actually uses a whole lot more air.
More air to the head voice and stuff?
To a style in the upper register. So it's a complex answer, but just be aware. If you could leave with the awareness that you don't always want more air, you might need more air. I'm not saying you never do, but you want to explore other options. Maybe it's support, maybe less air will help me get that top note. If I have less air, less pressure, more support. Yeah? Okay. Unfortunately, I could do this all afternoon, but guess what? It is 2:08 and you all have something else to do at 2:15 in your teams. So here's what I would love is I want the questions to keep coming to me. So if you can send me messages through Teams, send me notes, and we can set up a chat and we can keep answering some of these questions and your discoveries throughout the week. I would like to be as helpful as I can be for you. All right? Good? Thanks, everybody.
Thank you very much.
Oh, Kazoo, wait. Can I do one more fun part?
Please.
Yeah.
Kazoo,
Please.
I've been looking forward to the kazoo. Oh my god.
Oh my gosh, I almost forgot it. I don't want you to be late though. Okay.
It's my favorite
So,
part.
When you are trying to determine nasality, if my soft palate is all the way up and I have all the sound coming out my mouth, no air is coming out my nose. Or I can do an NG. It's all coming out my nose and none out my mouth. Blah, blah, blah. Everybody got that? The one that's in between is that mid that we use in contemporary musical theater and pop, where we have air coming out both. So if I do my Barbra Streisand imitation, a chickpea is neither a chick nor a pea, discuss, right? Dances unrehearsed. When she did that, she's singing, so if you want to know if you're using nasality, you simply use the kazoo. And then if I take it out, it's a really cool tool to help you find nasality. And I will be using these this afternoon in the masterclass when we work together. So I need to give you 5 minutes in between to use the restroom, get a drink, and be prepared for your teams. It was a joy and a pleasure. Your questions are amazing, and we will talk again. Bye.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you, Catherine.
Thank you so